Welcome to KrishnaIVF channel. In this video, I am going to discuss what are the effects of hypertension and what are the implications of hypertension and IVF. Hypertension affects 5% of all pregnant women, and this is expected to change with the rising age of the planned first pregnancy. Due to its frequent undiagnosis or delayed attention, hypertension at the reproductive age women have a lot of negative effects, and it is grossly underestimated. The impact of hypertension on a pregnant woman leads to a lot of complications called preeclampsia, also in a layman's term, hypertension during pregnancy. Second is placental abruption, that means early separation of the placenta during pregnancy. The third is early delivery or prematurity. The fourth is higher chances of cesarean section, and fifth is more babies born for women with hypertension, with chronic hypertension, will end up in higher risk of hospitalization into the neonatal center, that means in the premature care center of the hospital. These are the implications. When it comes to the actual IVF treatment, hypertension can affect the outcome of IVF treatment, but it does not prevent a person from undergoing the procedure. Pre-pregnancy hypertension is a risk factor for adverse pregnancy outcomes, and IVF embryo transfer with multiple pregnancy can exaggerate these risk factors in a hypertensive woman. Uncontrolled hypertension can lead to health problems such as blood vessel damage and reduced flow to the uterus and ovaries, which can affect the implantation, development, and growth of the baby. To maximize the chance of IVF success rate and minimize the complications, those with hypertension should have well-controlled blood pressure before starting the treatment. If they are already on the medication, adjustment to the antihypertensive drugs may be necessary under the joint guidance of the IVF specialist and the physician. The reason to say that is, not all hypertensive drugs are safe during pregnancy. In fact, in a recent research has shown that women with stage 1 hypertension or elevated BP before or during the pregnancy are at a higher risk of developing disorders of pregnancy and preeclampsia. A recent study found that the risk of hypertension preeclampsia in hypertensive women with IVF-ET pregnancies is 10% higher than in spontaneous pregnancy. In other words, a woman without a hypertension compared to a woman with hypertension who are planning an IVF, the one with the hypertension has higher risk of developing preeclampsia during pregnancy. It is essential to have a comprehensive discussion with your IVF specialist and the physician who is taking care of you to get a good control of the hypertension before embarking on an IVF treatment. This will help to minimize the complications and give a good outcome for you and for your baby.